Well, hello, everybody. I'm Hye-Jin Clark. I'm a member of the AAPM&R Content Creator Workgroup, a current chief resident at Stanford PM&R, and a member of the Fit Council Board. And I'm so honored to be speaking with Dr. Aaron Yang today, who's well known within our AAPM&R family. So I'm going to hand it over to him to give a brief introduction of himself.
Great, thank you. Well, my name is Aaron Yang. I am at Vanderbilt, and I practice interventional spine and musculoskeletal medicine. And I've been really involved in the academy for a while now. Really happy to be a part of the program planning committee, putting together a great resident course for our PGY2s, and looking forward to our annual meeting in Salt Lake City this year.
Well, thank you for the kind introductions. And so, Dr. Yang, you've been such a leader and influencer in this field of physiatry for so long, and just want to hear a little bit about why did you choose PM&R and why spine care particularly?
Yeah, great question. Well, I didn't know about PM&R until almost my fourth year of medical school. And it was by luck that one of my classmates mentioned the field to me. And I, again, had no clue. She knew that I liked the musculoskeletal system. I liked the peripheral neuroanatomy. And I did like the procedural things. I wasn't the personality to want to live in the operating room. And so she told me to check it out, and I did a rotation in it, and I loved it. And I think during residency there were so many things that I really enjoyed. I mean, I really enjoyed spinal cord injury personally, and just to see how we could make a long-term impact, not just physically, but mentally and emotionally, and just being there because I really like the continuity of care. But eventually, I gravitated more towards the outpatient side, and again, just liking the musculoskeletal medicine aspect and so having some of the procedural aspects. So part of it is just also when I came to Nashville 11 years ago now, there was such a need for non-operative spine care. And so there was a big window for me to build my practice through that. And so time has flown by. I've been in attending for 11 years, which is crazy because, my kids would say I still act like a kid sometimes, but really been happy with how we as physiatrists really can make a difference for our community.
No, thank you so much for your thoughtful introduction to your journey. And speaking of your passion for spine care, you are actually spearleading the Advanced Clinical Focus Day for Spine and Pain this year. So tell us a little bit about the two sessions that you'll be leading.
Yeah, so one of the big things that the program planning committee has really tried to focus on is bringing higher level, more advanced topics to our audience. And so Dr. Leah and I, as part of the pain and spine subcommittee, have been sort of spearheading and trying to bring three sessions together, which Dr. Lee is spearheading one. And two of the sessions I wanted to share that I'm really excited about. One of them is from the group at the University of Utah, which is great because when we're in a city that has a great academic medical center, we can take advantage of their faculty there. And this session is going to be focused on osteoporotic vertebral compression fractures, something that's we can see in spine care. But I think the unique thing about this session is we are bringing in multiple different specialties to talk on this topic, because I think this is truly a diagnosis that you want to work with a team. So Dr. Smolinsky is the session director, and she was great in recruiting multiple different faculty members at the University of Utah. So alongside herself on the panel, we will have a sports medicine, internal medicine trained physician who will talk about the non-surgical management and some of the great things that she does in terms of osteoporosis care and bone health. And then you also have Dr. Conger, who is the interventional physiatrist. We'll talk a little bit about some of the procedural aspects that you can utilize for treatment of this. And then there's also a orthopedic spine surgeon to hear from their input of when they should intervene or when you may consider referral to spine surgeon. And then lastly, a physical therapist to also talk about how they would manage from their aspect. So anytime you get a multidisciplinary panel like this, I think it's awesome to hear their perspective and of when they can really make a difference in patient care from their perspective. So I'm really excited about that. And then the other session is going to be led by Dr. Furman, who has been around for many years, one of the godfathers of interventional physiatry. And he has put together a great panel of 5 different interventional physiatrists from different backgrounds. And it's the main topic's going to be about continuing or discontinuing antiplatelet or anticoagulant medications, and they'll provide up-to-date information on the literature to date, talk a little bit about the different guidelines that are out there, and really just have a discussion on different procedural interventions and when they would continue or discontinue these medications. So again, some people may think this is a basic topic, but there's a lot of nuance, and a lot of people will approach this in different ways, use different guidelines in their own practice. So it'd really be fun to hear from a panel and sharing their viewpoints on the use of these medications in the light of procedures.
These are two excellent topics. I think osteoporosis is a hot topic right now, and also use of anticoagulation. How did you come up with these two topics? Because within the interventional pain and spine world, there's a lot of different topics that we could be talking about, but why these two specific topics?
I think one of them is we wanted to have a multidisciplinary panel. And as we were thinking about, okay, what is a topic that spans different specialties, or a diagnosis that multiple different specialties may get involved with, I think we narrowed it down into compression fractures and osteoporosis. And so that was sort of how we came to that one topic. And then the other topic is also making it useful for also just our general community that are coming to these conferences, something that also can be a little bit more nuanced and advanced, and something that we encounter every day, which if we're doing any type of procedural procedures in general, this topic comes up over and over again. And sometimes we just get into this mode of, okay, like this is the guideline I use. Well, there's no discussion back and forth. And a lot of our trainees ask about it. And so I think that this is a great time to bring a topic that we often encounter every day and could be very useful to our physiatry community.
No, we really love that. And annual assembly is a time that we can really all get together and really hear from a multidisciplinary team. And speaking of annual assembly, which is happening in Salt Lake City this year at the end of October, we'd love to hear your thoughts on what are you looking forward to the most at the annual assembly, and why do you keep coming back to the meeting? Because you've been in practice for the past 11 years, you mentioned, and there must be something that pulls you back to the various locations of the meeting. So we'd love to hear your thoughts and get people excited about the annual assembly.
Yeah, I mean, I think the one of the big things that draws me is the people. It's the networking, catching up on our colleagues. And I think the great thing about the academy is we are drawing people from all different subspecialties, general physiatry, spinal cord injury, brain injury, and it's a great time to get together, catch up on what people are doing, networking. I think a lot of great relationships and opportunities come from meeting people one-on-one or as groups. And so it's been great. I know a lot of people will get into different subspecialty conferences, but this is just a time where we come as physiatrists of what we're primarily trained in and come together. And again, I am excited about what we're doing here with these advanced clinical sessions, because we're making it more pertinent to subspecialists by bringing these more advanced topics that they may get at other subspecialty conferences. And so we want it to work for people for all different training levels, and for people who've been in practice for many years, we want to make it useful for them as well. So aside from this clinical content, it's really about seeing people face to face from all different specialties within our field.
Excellent. No, thank you for sharing all your thoughts and wisdom on that. And Dr. Yang is actually one of our very highly regarded AAPM&R innovators and influencer recipient this year. And Dr. Yang, as a leader in both the education and education in musculoskeletal and spine care space, what leadership lessons have you learned that are critical for advancing the field over the course of your practice?
Yeah, I mean, I think there's a couple ways to look at it. If you're thinking um, as physiatrists, I think we could really help out in any health system. We can help out any medical field. I feel that we are truly needed, and sometimes people don't recognize it. So if I had a young trainee or new faculty, I would say first think about what type of patients you want to take care of, or how do you feel like you can help certain patients the most? And then think about how you would have access to those patients. So a lot of times we can really excel if the frontline providers, oftentimes these are primary care providers. And I think of it from my world as a non-surgical specialist. The front door is usually manned by primary care, urgent care. And so I really would encourage a lot of new faculty or young residents to really think about how can you connect and build relationships with these people. Because I think the more time you spend with them and the more time that you may be able to give a lecture or interact, they can really see how much value we can bring. And so as I think about, I haven't been practicing for 30 years, but just 11 years, I think that those relationships have been so crucial to my career satisfaction because they know how I can help their patients. And through our relationships, I also agree because there's sometimes where I feel like I don't know how much I have to offer here, but I will do my best. But then you can reach a point where a lot of these referring physicians understand what you do and you feel like you're really making a difference in their lives. And so really trying to build a collaborative network outside of your own sphere and going to these other frontline providers, I think has been really beneficial. And then, I think in terms of academics, again, I think that we can have lots of different roles, whether we're in a big academic system or in private practice. And it just depends on where people's passions lie. You'd be surprised. I tell people it doesn't hurt to ask other people if there's ways that you can provide some kind of education or teaching opportunities. People may, once they hear your elevator pitch, which you should practice a little bit, I think that they'd be very open to having someone who's so interested in sharing their knowledge with other people. So, for me, I love to teach and bring education to other specialties because I think that we as physiatrists have so much to offer to our patients and community.
Absolutely. And Dr. You've been a true leader in just the early career of PM&R space by creating space for the R2 residents to kind of do retreats. So we are really grateful for all your trailblazing in the field of education and advancing forward what PM&R has to offer. And so, Dr. Yang, just to close things up, we want to end with a fun question. So, if there was an Olympic event for something you do outside of medicine, whether it's a hobby, talent, or a hidden skill, what event would you be competing in?
That's a really good question. I don't think I have any talents. I have hobbies. I like to run, but I don't think it could ever be in any Olympic event. Um, I guess a funny thing is one of the therapeutic things I find after work is coming home and cleaning up after my kids. It's a hidden, I wouldn't say talent, but I find that my wife is always knows like when I get back, it's like I'm cleaning up left and right. And I don't know, I just find it oddly therapeutic and fun just putting things away. Um, and maybe that will change as the kids eventually get sick and tired of me telling them to clean up. But I don't think it'll ever be an Olympic event. But I guess that's a hidden, I don't know, unwanted hobby that I just have.
But it is so productive though. So it can be like all the parents ready, set, go, put the timer and clean it, how fast I can clean up. And
Yeah,
that'd be something that I think people, I'm glad that you're a good husband to your wife. I'm pretty sure
yeah.
that's very helpful
I'm
too.
trying. She's not on this, so she can't have a say in it, but at least I'm trying.
Your father and husband are here, right here.
Yes.
So Well, Dr. Yang, thank you so much for, getting us excited about the Spine and Pain Advanced Clinical Focus Day and for all that you're doing for the PM&R community. We are grateful for your leadership and your entrepreneurship for making things happen here at AAPM&R. And we are looking forward to all gathering together in Salt Lake City this year.
Great. Thank you so much and look forward to seeing you in Salt Lake City.
As well. Thank you so much.